Michael Gallagher again with your second stage of strengthening the injured knee joint. Again, reminding you that these exercises should only be performed if you're not having pain or discomfort, or again, slight discomfort. A 4 on a scale of 1 to 10 would be fine. We don't want to go past that point, but we're starting to feel a little better. We notice our swelling is decreased. So what do we do next? How do we strengthen the leg? How do we regain our function? So the next exercise we'll do in our series of exercises will be working on the abductor muscles, or the outside muscles. So just a quick review, the first two exercises that we've done are a quadricep setting, where we place a pillow underneath the knee, we push down into the pillow, dorsiflexing or bringing the foot up, holding for a count of 5 seconds, and relaxing. The second exercise that we had done in the past was the adduction exercise, or adductors. It's squeezing the pillow, holding for a count of 5. Any pain with that?
No.
Good. And relaxing. So now we're going to take it to the next step. We're going to take the next step. We did straight leg raises, which is a tightening and a lifting and holding for a count of 5, working on the quadriceps muscle. And relax. So similar to our quadricep sets, we tighten first, we bring the toes up, we lift 6 inches off the table, and hold. 1, 2, 3, 4, 5. That should be felt in the quadriceps. There may be a little discomfort in the kneecap or the knee joint as we're using it. Some people will even feel pain in the patellar tendon. The importance there is keeping the knee as straight as possible so we don't put extra stress on the patellar tendon. The other thing you want to be careful of is not to overlift. You don't want to be a rocket. You want to actually only lift about 6 inches up. Tendency is, as we get tired or we fatigue, we use our quadriceps less and we start using our hip flexors, bringing the leg higher. Higher is not better. We want to keep about 6 inches. So the next exercise we're going to do in our series is our abduction, or taking away from the body. So we're going to have Michael turn towards me. He's going to tighten the leg, bring the toes up, and lift 6 inches to the side, working on the muscles on the outside of the knee joint. Again, holding for a count of 5. 5 and down. Does that feel okay?
Yep.
Good. Again, 15 repetitions, holding 5 seconds each. Now we're going to go to the back of the leg, or the hamstring. So let's turn onto your belly, Michael. I'm going to give you this pillow, make you a little more comfortable. With your feet hanging off the edge of the bed or the edge of your couch, what you're going to do again is tighten the musculature in the leg and lift straight up off the bed and holding. Dorsiflexing or pointing the toes up to you for a count of 5. 1, 2, 3, 4, 5, and down. Problem with this exercise is many people complain of low back pain because of the position. What I will do is suggest that a patient, if they're having problems with this, is taking a pillow, lift up and placing it underneath your belly, placing your belly a little bit more of an anterior pelvic tilt, taking some of the stress off your low back. We're going to tighten, and toes the other way, and hold. That feel a little better?
Yeah.
1, 2, 3, 4, 5, and down. Good. You can turn on over. So now we've worked the quadriceps, the leg adductors or inside muscles, the abductors, and the hamstrings. Another way which we can work the adductors of the muscles, also working on that inside knee muscle called the vastus medialis, is progressing our adductor exercise from squeezing a pillow to actually doing a straight leg raise with the adductors. So what I'll do is I'll have Michael turn and face the camera. He's going to take the uninvolved leg, he's going to bend it, he's going to bring his injured knee underneath, and he's going to lift and hold. 1, 2, 3, 4, 5, and down. So this could be added to your repertoire of exercises for the knee joints. Quadriceps, abductors, adductors, and hamstrings. On our next video, we'll talk a little bit about how to stretch out the knee joint.